An East Bay nonprofit is urging older adults to get vaccinated against the flu and COVID-19 as cases of the respiratory viruses begin to ramp up for the season. The Center for Elders Independence says seniors face an increased risk of hospitalization and serious illness, even death, especially those with chronic conditions like diabetes or heart disease. Experts are predicting it will be another severe flu season, which typically begins in late October. So now is the time to be thinking about this. For more, we're joined here in the studio by Dr. James Mittelberger, the Chief Medical Officer at the Center for Elders Independence in the East Bay. Doctor, always good to have you on.
It's good to be here.
Absolutely. I know this is so important, and the timing is so important on this. What is the message you are giving to older adults here in the Bay Area about getting vaccinated?
The message is everybody agrees that both the COVID and the influenza vaccine are important for seniors to get. Both diseases are serious. Both diseases are potentially deadly. And the vaccines work for people. There are controversies, and we know there's a lot of misinformation and confusion out there, but the CDC, it's not a political issue. Everybody agrees that seniors should be getting these two vaccines.
Yeah, well, when you talk about sort of the controversy, I mean, obviously, recently, last month, I believe it was, that the CDC, they backed away from universal recommendations for the COVID-19 vaccine. How has that impacted the work that you're doing to try to convince older adults to get the shot?
People are a little confused. You know, nobody wants to get a shot. And so if they're a little worried, well, what does this mean? Maybe people don't recommend it. So we're seeing more and more people saying, well, maybe I thought somebody said I shouldn't get this. So my message is no, actually everybody does agree. For elders, people at risk, people with serious medical conditions, these vaccines save lives.
Yeah, and up to 85% of flu-related deaths are seniors nationwide. That's according to CDC data. What are the biggest reasons why older adults face such a greater risk of severe illness?
Well, you know, your immune system does begin to age. I can tell you about T cells and certain kinds of immunity. As you get older, you're more vulnerable. Plus the systems, your lungs, your heart, they're weaker in general, so they have less resilience for the same level of disease. So the reality is you add these things together and it becomes much more risky for older people.
All right, so what is the outreach campaign that the Center for Elders Independence is launching in the community here as we begin to see the flu and COVID-19 season ramp up? Well, how are you trying to reach folks and make sure they do get those shots?
We are letting every single participant know that we strongly recommend both of these shots. We tell them that this has actually been studied. A few years ago, it hadn't been studied, but a big study in the New England Journal just came out. You can get both of these shots on the same day, and they work beautifully. And you might have a sore arm, you might feel a little tired, but they work beautifully together and save lives. So that's that message every day, being very clear. Please get these shots. Yeah, please save your own life.
For people who are hesitant, have you been able to sort of break through that hesitancy? Have you found that a direct conversation like the one we're having is impactful?
Absolutely. Yeah. I mean, everybody, we create bonds of trust at our Center for Elders Independence. We have every one of our participants has a provider. We provide a lot of touch and around and care, so we're able to achieve a pretty high level of vaccination. What I want to do also as a member of this community is to take that story out to the broader community, people that may not have that same connection with a physician or a provider, make sure they know everybody agrees that these vaccines are important for elders.
All right, when we talk about the shift in guidance from the CDC when it comes to COVID-19 vaccines in particular, no longer recommending it for all age groups, there has been a conversation about that limiting the availability of the shots for some people in the community. Are you finding any of the older adults that you work with are having difficulty getting COVID shots?
Well, we cover everything for our participants. There's no copay at the Center for Elders Independence. I'm really proud of our program. So for us, no issues. I don't think anybody on Medicare, or I don't even think an elder on Medi-Cal should have a problem. And it's a little bit more insurance plan specific. The CDC did recommend younger people talk to their provider. That's not unreasonable, But this day and age, it's hard to have a conversation. So it may actually not be a good idea because it should really be very easy. We have proven, as I'll say it one more time, the study's been done. It's been asked and answered on diverse populations of a whole range of age groups, largely veterans. These vaccines work. And the flu vaccine and the COVID vaccine work given on the same day, and they will save lives.
Yeah, it's important to reiterate that. Appreciate you coming in. Always good to see you. Dr. James Mittelberger with the Center for Elders Independence.
Thank you. Pleasure to be here.
Absolutely. Heather, we'll send it over.